CBS 46 News presents Public Affairs on Peach.
Good morning to you. Welcome to Public Affairs on Peach. I'm Karen Greer. Well, you know, October is Breast Cancer Awareness Month, and today we're going to talk to a survivor about her journey and a doctor about what you need to know about breast cancer, including clearing up some misconceptions out there. And we'd like to welcome today to talk to us Dr. Sheldon Linsenberg. So glad to have you here. And you've really done a lot when it comes to the field of breast cancer, and you do a special event for women. We're going to talk about that a little later. But as a surgeon, you are seeing, I think, patients younger and younger, aren't you?
Yes, it's always been that way, but it's raised the level of awareness to the point where we now know that breast cancer can strike even at the age of 20 or so.
And what kinds of treatments do you do for women who are that young?
I'm a reconstructive surgeon. I'm a plastic surgeon, and when women at that age have to deal with breast cancer, they want to go back to their normal life as soon as possible. They want to lead the rest of their life as a normal person, and so I help reconstruct their breasts after the treatment for breast cancer.
Reconstruction has changed so much in recent years, and then there were treatments that were, I think, just really developed here in the Metro Atlanta area. Talk about a couple of those.
Yes, indeed. For many years, the breast reconstruction universe consisted of using implants to rebuild the breast. The first move into utilizing your own tissue to create natural breasts was developed here in Atlanta in the mid-'80s.
Hard to believe. And that doctor was?
Dr. Carl Hartranft designed and worked out the nuances with the tram flap. And we now have multiple areas of the body that can donate tissue in form of flaps to create breasts or other areas of reconstruction.
I know it's a very tough time for a lot of women just for first hearing that they have breast cancer. Usually your work comes in right after the surgeon goes in and removes what they believe to be all the cancer in a breast or in a double mastectomy. And then you come in to start the reconstruction process, which could take a while.
That's correct. At times we will start the reconstruction before the patient is awakened from the anesthetic. This is known as an immediate reconstruction. At other times, some people can't get their arms around all of that information and dealing with all of the emotions, and they prefer to defer the reconstruction until a few weeks or even a few years later.
Wow. And let's talk a little bit too about, you know, there's so many different misconceptions about the surgery and how it happens and what women are thinking when you are doing these different modes of surgery for them. Some just choose a lumpectomy, which requires no type of reconstruction, correct?
That's correct.
But some will try and do the bilateral mastectomy, which that's got to be difficult on their bodies as well.
It certainly is, and the thought process regarding removing the other breast as well, which has no cancer at the present time, is that we know women that have had breast cancer have a higher risk of developing a second breast cancer. Something on the order of 1% risk per year for the remainder of your life.
And what are we learning about the genetics of breast cancer?
That field continues to develop. Initially, one gene was identified as being passed along down the line in families, and if it's in your family, you have a higher chance of developing breast cancer. There have been many more genes now identified, and we're fairly certain that we have not identified all of them as yet.
Talk about early detection. A lot of physicians have said, and surgeons, that it is the key in fighting this disease. Do you agree with that?
Yes, it really is. And the best form of early detection is self-examination. I think every woman, as she enters adulthood, should be taught by a physician or a nurse how to examine her own breasts.
And should pick one particular time a month, or maybe the same day every month. And we tried to do a same day to remind you and remind perhaps a friend to do the same thing. So there is a process to it. You're just not feeling, but you're looking in a circular motion. Is that the way the breast self-exams are done now?
I do the examination a little bit different than the circular motion, but that is one of the techniques that's very widely used.
All right, and mortality rates. have they changed in, we're 2015 now. At one point, a woman was diagnosed and a lot of times thought it was a death sentence.
The mortality rate has improved if the diagnosis is early. And we're making more of the diagnoses earlier and earlier. However, overall, the mortality rate has changed very little.
How long does it take for a woman to just fully recover after having reconstructive surgery?
That's a difficult question to answer. It often depends on the extent of the reconstructive surgery. But generally, you are back in your normal lifestyle within about 4 to 6 weeks.
Which is great to hear.
Yes.
Anything that you would tell women out there who are concerned, they've gotten news, bad news, that they perhaps have breast cancer and really don't know how to proceed? How do they go that next step and think about options?
I think it's very important to reach out to your friends, to your family, to your physician, and get as much support behind you as possible to take that road through your treatment course and into the rest of your life. And when you do it as a group with family and friends, with a support group, you have a much better chance of handling this emotionally than being all on your own.
Do you feel nervous when a woman comes to you and says, I want a second opinion?
No, not at all.
I think a lot of women are fearful of saying that to a doctor because they feel like, this is my doctor, I don't want to hurt their feelings.
Mm-hmm.
Don't have a problem with that at all. Why?
Not at all. Sometimes a second opinion is what somebody needs to it's important to register what you've heard one time because you don't hear it all. Once you hear the diagnosis of cancer, oftentimes you start thinking and you're not hearing another word that goes on through that first consultation. A second opinion, a second consultation, or even a third will allow you to open your mind to hear the rest of the story and the information that you want to bring together.
All right, Dr. Linsenberg, thank you so much. We're going to keep you around and talk to you in a little bit. When Public Affairs on Peach returns, a breast cancer survivor shares her experience with us. Don't go anywhere. We'll be right back.